Hi, I'm Pat Adams, retired leader of state and local public health agencies, and I'm really happy to be with you today to talk about eHealth. Healthcare at the state and federal levels is progressing rapidly toward the goals of more accountable care that achieves better value related to cost and healthcare outcomes, and improve overall health of the population as a whole. Without transformation of our healthcare delivery system at the individual level, as well as at the systems level, America's healthcare system as we have known it is unsustainable. We need to work smarter to improve the coordination of care between medical, behavioral health, social services, long-term care, and public health systems. Improved care coordination results in better utilization of costly medical care, reduction in duplicative tests and procedures, and improved health outcomes for individual patients. The adoption of eHealth technology by local public health agencies will advance our capacity to provide more efficient and effective services to the communities served throughout Minnesota to achieve overall local and state public health goals. For nearly 3 decades, Minnesota's public health agencies have been incrementally building their eHealth capacities. This has happened through collaborative partnerships to develop eHealth products that would assist in tracking and reporting on local public health services that are provided to individuals and groups. Because of these existing alliances, local public health agencies are coming together to specify requirements to buy common products that will support the interoperability and exchange of individual health information. Through cost-sharing approaches for the development of these products and systems, local public health agencies will advance their capacities to more effectively integrate and exchange health data generated through their case management and clinical services with medical, behavioral health, and other community partners. Let's use a specific case example to highlight the importance of interoperable health records. Mr. Z is a resident of a county in Minnesota. Mr. Z and his wife have 3 school-aged children. He works for a poultry processing plant. During a routine health assessment by his employer, Mr. Z has a positive reaction to a Manto test, indicating potential activation of tuberculosis in his body. The status of Mr. Z's tuberculosis diagnosis and treatment must be determined through physician exam, laboratory testing and x-rays, and potentially hospital care. Mandated disease reports are made to the state and local public health agencies, which are responsible for communicable disease surveillance and control efforts to assure individual and community-wide containment of this disease. It benefits all healthcare providers involved with the care of Mr. Z, as well as Mr. Z and his family, to be able to exchange eHealth data to assure the most prompt and effective treatment for Mr. Z to contain the spread of tuberculosis within his family and within his business, school, and community contacts. Interoperable health records strongly support such health protection measures. A concern of local public health agencies and their governing boards is that the mandate to build their capacity to integrate and exchange health data with medical providers through eHealth technology is an unfunded mandate. An effective approach to address this concern can be to join an existing local public health information partnership to specify requirements with a vendor that can address and meet common health information exchange needs. Investment in eHealth technology should result in a good return on investment through improved efficiencies of internal work processes that are already required to coordinate and exchange individual patient information between the public health agency and healthcare providers. Clients of local public health agencies will benefit in a number of ways from the adoption of interoperable electronic health records. Clients and their families will benefit from improved coordination of health services with and between providers serving an individual patient. Clients will also experience reduced duplication of testing, requests for common information, and errors resulting from lack of communication between providers. Clients will experience improved health outcomes and patient satisfaction resulting from better coordination of care. Healthcare providers will also receive benefits from the use of technology to exchange health data, Several benefits to health providers include: first, improved communications can help establish and maintain focus on common patient health improvement goals. For example, if a patient sees multiple specialists and community providers, eHealth can help ensure that providers are working off a common game plan. Secondly, improved patient safety goals should be achieved because of the potential for error reduction that currently results from handwritten orders and other manually generated reports. Thirdly, improved work processes related to referrals, tracking, reporting, and care coordination will free up valuable time for providers to be able to practice at the top of their professional licenses, resulting in improved job satisfaction. Interoperable electronic health records will increasingly become an expectation of informed consumers. As consumers become more comfortable with shared decision-making about their own health care improvement and treatment plans, they will increasingly expect that providers are capitalizing on technology to deliver the most effective care. Consumer engagement in their own health is a key 21st century strategy for individual and population health improvement. Interoperable electronic health records will be an important tool for engaged consumers. The Health Information Technology Toolkit for local public health agencies is a primary tool for local agencies to move ahead during this period of transition from paper-intensive to e-health technology systems. This toolkit can be customized to the readiness of individual agencies to advance their skills and capacities. Another significant tool is the partnerships that already exist among local public health agencies in Minnesota to collaborate to seek solutions to common problems. The importance of Minnesota's unique environment of collaboration cannot be understated. It is a valuable asset to advancing this work in Minnesota. It can be a daunting task to determine how to most wisely invest in the use of technology to improve work processes and exchange health data with community partners. Every type of health provider is concerned about making the right choice in the selection of electronic health record products. Resources are scarce, and no one wants to buy a product only to find out that it won't meet your needs. The HIT toolkit that has been developed for local public health agencies is an important tool to support your decision-making as you assess your needs, evaluate your options, and determine the next steps that you need to take to move ahead in the development of your technology capacities. Over time, I'm sure that we'll find that the adoption of electronic health records will enhance the quality of patient care and improve population health, while also supporting greater efficiencies with administrative tasks.